Today, we are covering acid-base imbalances, a topic that is guaranteed to appear on your nursing exam. The key to mastering these questions is a systematic approach to interpreting arterial blood gas or ABG results. Forget memorizing endless lists of causes. Let's focus on interpretation and priorities. First, you need to know the normal values. The pH should be between 7.35 and 7.45. The PCO2, which represents the respiratory component, is normally 35 to 45. The HCO3 or bicarbonate represents the metabolic component, and its normal range is 22 to 26. The most powerful tool for these questions is the mnemonic ROME, which stands for Respiratory Opposite, Metabolic Equal. For respiratory issues, the pH and the PCO2 will move in opposite directions. If the pH is low, indicating acidosis, the PCO2 will be high. For metabolic issues, the pH and HCO3 will move in the same, or equal, direction. If the pH is low, the HCO3 will also be low. Let's apply this. An exam question gives you ABG results for a post-operative patient who is breathing shallowly due to pain. The results are pH 7.25, PCO2 58, and HCO3 24. First, look at the pH. At 7.25, it's low, so we have acidosis. Next, look at the PCO2. At 58, it is high, which is the opposite direction of the pH. This signals a respiratory cause. The HCO3 is normal. Therefore, the patient has respiratory acidosis. The exam will ask for your priority nursing action. Since the cause is hypoventilation from pain, the priority is to improve the patient's ventilation, which might involve administering pain medication so they can breathe more deeply. The trap here is choosing an option like administering oxygen. While oxygen might be needed, it doesn't fix the root problem, which is the retention of CO2. Now consider respiratory alkalosis. A patient comes to the emergency department with a panic attack and is hyperventilating. Their ABGs are pH 7.50, PCO2 28, and HCO3 25. The pH is high, indicating alkalosis. The PCO2 is low, which is the opposite direction of the pH. This confirms respiratory alkalosis. The patient is blowing off too much CO2. The nursing priority is to address the cause, which is hyperventilation. You would coach the patient to slow their breathing. The classic intervention tested is having the patient breathe into a paper bag to rebreathe some of the exhaled CO2, helping to bring the level back to normal. Let's move to metabolic acidosis. An exam question describes a patient with diabetic ketoacidosis, or DKA. Their ABGs are pH 7.20, PCO2 30, and HCO3 14. The pH is low, so it's acidosis. The HCO3 is also low, which is in the same, or equal, direction as the pH. This points to a metabolic cause. Notice the PHCO2 is also low. This is a common exam trap. This isn't a respiratory problem, it's compensation. The body is trying to fix the metabolic acidosis by increasing the respiratory rate to blow off CO2, an acid. This deep, rapid breathing is known as Kussmaul respirations. The priority is to treat the underlying cause, DKA, which means administering insulin and fluids as ordered. Finally, we have metabolic alkalosis. A patient has been experiencing severe vomiting for 3 days. Their ABGs show a pH of 7.52, PCO2 of 40, and HCO3 of 35. The pH is high, indicating alkalosis. The HCO3 is also high, moving in the same direction. This is metabolic alkalosis, caused by the loss of stomach acid. A common trick on the exam is to link metabolic alkalosis with hypokalemia as potassium ions shift into cells. Therefore, the priority nursing interventions include administering IV fluids to correct dehydration and closely monitoring the patient's potassium levels and cardiac rhythm for any signs of dysrhythmias. The exam wants you to connect the loss of gastric juices to the loss of acid and the resulting electrolyte imbalances. By using the ROME mnemonic and focusing on the underlying cause, you can confidently answer any acid-base imbalance question the exam throws at you.